Welcome to the NCLEX-RN Practice Test, Basic Care and Comfort Part 1. This quiz contains 50 questions to help you prepare for the NCLEX-RN exam. Let's get started. Question 1. Which pain assessment tool is most appropriate for a 3-year-old child who is able to point to pictures but has limited verbal communication skills? Option A, Numeric Rating Scale, 0 to 10. Option B, Wong-Baker-Faces Pain Rating Scale. Option C, FLAC Behavioral Pain Assessment Tool. Option D, CRIE's Neonatal Pain Assessment Tool. The correct answer is B. The Wong-Baker-Faces scale is designed for children ages 3 and older who can point to the face that best represents their pain level. It uses 6 faces ranging from happy, no pain, to crying, worst pain, making it developmentally appropriate for preschoolers with limited verbal skills. Question 2. According to the WHO analgesic ladder, which medication is classified as a Step 2 analgesic for moderate pain? Option A, acetaminophen. Option B, ibuprofen. Option C, codeine. Option D, morphine. The correct answer is C. The WHO analgesic ladder Step 2 includes weak opioids for moderate pain, which includes codeine, tramadol, and hydrocodone. Step 2 medications bridge the gap between non-opioids Step 1 and strong opioids Step 3. Question 3. A nurse is assessing a patient's pain using the PQRST method. The patient describes the pain as burning and shooting, like electricity going down my leg. Which component of PQRST does this statement address? Option A, provocation/palliation. Option B, quality. Option C, region/radiation. Option D, severity. The correct answer is B. The PQRST assessment method evaluates provocation/palliation. What makes it better/worse? Quality, description of pain character, region/radiation, location and spread, severity, intensity, and timing, duration and pattern. Describing pain as burning and shooting, like electricity, describes the quality or character of the pain, which is characteristic of neuropathic pain. Question 4. A patient with chronic lower back pain for 8 months reports persistent aching discomfort that interferes with daily activities. The nurse understands that this pain is classified as which type? Option A, acute pain. Option B, chronic pain. Option C, neuropathic pain. Option D, phantom limb pain. The correct answer is B. Chronic pain is defined as pain that persists for 3 to 6 months or longer and continues beyond the expected healing time. This patient's pain has been present for 8 months, meets the temporal criteria for chronic pain, and demonstrates the persistent nature that interferes with daily functioning characteristic of chronic pain conditions. Question 5. A patient with postoperative pain rates their discomfort as 6/10 on the numeric scale. The nurse reviews the current medication order for acetaminophen 650 mg every 6 hours PRN, which was effective for the patient's mild pain earlier. Based on the WHO analgesic ladder, which action should the nurse take? Option A, continue the current acetaminophen regimen as ordered. Option B, administer ibuprofen in addition to acetaminophen. Option C, request a Step 2 analgesic order from the provider. Option D, apply non-pharmacological interventions only. The correct answer is C. According to the WHO analgesic ladder, moderate pain, April 6, 10, requires Step 2 interventions, which include weak opioids such as codeine or tramadol. The current Step 1 non-opioid, acetaminophen, was appropriate for mild pain, but is insufficient for moderate pain escalation. The nurse should advocate for appropriate analgesic progression. Question 6. A patient receiving morphine via patient-controlled analgesia (PCA) pump has a respiratory rate of 10 breaths/minute and is difficult to arouse. Which action should the nurse take first? Option A. Notify the healthcare provider immediately. Option B. Administer naloxone as ordered. Option C. Decrease the PCA basal rate. Option D. Encourage the patient to take deep breaths. The correct answer is B. Sedation precedes respiratory depression with opioid administration. A respiratory rate of 10 breaths/minute with decreased level of consciousness indicates opioid-induced respiratory depression, a life-threatening emergency. The priority action is to administer naloxone, an opioid antagonist, to reverse the effects and restore adequate respirations. Question 7. A nurse is caring for a 4-month-old infant who underwent surgery 6 hours ago. The infant is crying inconsolably, has drawn-up legs, and an arched back. The infant's face is flushed and grimacing. Using the FLAC pain assessment tool, the nurse assigns which of the following scores? Option A. FLAC score of 2, mild pain. Option B. FLAC score of 5, moderate pain. Option C. FLAC score of 7, moderate severe pain. Option D. FLAC score of 10, maximum pain. The correct answer is C. The FLAC scale scores each category 0 to 2, face, 0 equals relaxed, 1 equals grimace, 2 equals grimace/cry, legs, 0 equals relaxed, 1 equals restless, 2 equals kicked/drawn up, activity, 0 equals quiet, 1 equals restless, 2 equals arched/rigid, cry, 0 equals no cry, 1 equals moans, 2 equals cries inconsolably, consolability, 0 equals content, 1 equals consolable, 2 equals inconsolable. This infant scores: face equals 2, legs equals 2, activity equals 2, cry equals 2, consolability equals 2 minus typical consolability pattern, but given inconsolable crying with grimacing and drawn-up legs, the score is 7. Question 8. A 72-year-old patient with diabetic neuropathy reports burning, tingling pain in both feet that worsens at night. The patient has been taking acetaminophen with minimal relief. Which medication would the nurse anticipate being most effective for this type of pain? Option A. Morphine sulfate. Option B. Gabapentin. Option C. Ibuprofen. Option D. Hydrocodone. The correct answer is B. Gabapentin is an adjuvant analgesic specifically effective for neuropathic pain, which is characterized by burning, tingling, and shooting sensations. Diabetic neuropathy is a classic neuropathic pain condition. Gabapentin works by modulating calcium channels to reduce neuropathic pain signals, making it more effective than traditional analgesics for this pain type. Question 9. A patient with metastatic cancer has been on a stable opioid regimen with adequate pain control. Over the past week, the patient's pain has increased from 3 out of 10 to 7 out of 10, requiring frequent breakthrough doses. The current regimen includes extended-release morphine 60 mg twice daily and immediate-release morphine 15 mg every 4 hours PRN for breakthrough pain. Which action represents the most appropriate application of WHO analgesic ladder principles? Option A. Add acetaminophen to the current regimen. Option B. Increase only the breakthrough morphine dose. Option C. Increase the extended-release morphine dose and recalculate breakthrough dose. Option D. Switch to a different opioid entirely. The correct answer is C. Who analgesic ladder principles include by the ladder appropriate step and for the individual titrate to effect. When a patient on a step 3 strong opioid has escalating pain, the appropriate action is to increase the around-the-clock, scheduled, dose to maintain adequate baseline pain control. The breakthrough dose should be approximately 10 to 20% of the total daily dose, so increasing the extended release dose requires recalculating the breakthrough dose proportionally. Question 10. A nurse is developing a pain management plan for a patient with chronic osteoarthritis who has a history of substance use disorder. The patient rates pain as 5 out of 10 and expresses fear of taking opioid medications. Which comprehensive pain management approach best demonstrates who analgesic ladder principles while addressing the patient's concerns? Option A. Prescribe step 2 opioid tramadol with frequent monitoring and naloxone education. Option B. Implement step 1 non-opioid medications plus non-pharmacological interventions as first-line therapy. Option C. Avoid all analgesic medications and use only non-pharmacological interventions. Option D. Prescribe step 3 strong opioid with strict medication agreements and urine monitoring. The correct answer is B. The WHO analgesic ladder emphasizes by the ladder start at appropriate step for pain level and for the individual consider patient factors. For moderate pain, 5/10, with opioid concerns and substance use history, starting with step 1 non-opioids, acetaminophen, NSAIDs, combined with non-pharmacological interventions, heat, TENS, exercise, weight management. Respects patient preferences, addresses addiction concerns, and follows evidence-based guidelines for osteoarthritis. Question 11. According to MyPlate guidelines, which food group should occupy the largest portion of a client's plate? Option A. Protein foods. Option B. Grains. Option C. Vegetables. Option D. Dairy. The correct answer is C. MyPlate guidelines recommend that vegetables and fruits together fill half the plate, with vegetables occupying a slightly larger portion than fruits. This promotes intake of fiber, vitamins, and minerals while managing calorie density. Question 12. A 68-year-old client with newly diagnosed heart failure is being discharged. The nurse provides dietary education about sodium restriction. Which statement by the client indicates understanding of the teaching? Option A. I can use salt substitutes freely since they don't contain sodium. Option B. I should limit my daily sodium intake to less than 2 grams. Option C. Canned vegetables are a good choice since they're nutritious. Option D. I only need to avoid adding salt at the table. The correct answer is B. Clients with heart failure require sodium restriction to less than 2 grams per day to prevent fluid retention and exacerbation of symptoms. This is the standard recommendation for HTN and heart failure management. Question 13. A nurse is preparing to administer a bolus feeding through a client's nasogastric (NG) tube. Before starting the feeding, the nurse aspirates 250 milliliters of gastric residual. Which action should the nurse take? Option A. Return the residual to the stomach and administer the feeding as scheduled. Option B. Discard the residual and administer half of the scheduled feeding. Option C. Hold the feeding and reassess in 1 hour. Option D. Hold the feeding and notify the healthcare provider. The correct answer is D. Gastric residual greater than 200 milliliters before a bolus feeding indicates delayed gastric emptying and increased risk for aspiration. The nurse should hold the feeding and notify the healthcare provider for further orders, which may include prokinetic medication or switching to continuous feeding. Question 14. A 72-year-old client was admitted with dehydration. The nurse reviews the following assessment data: blood pressure 98/58 millimeter of mercury, heart rate 112 bpm, urine output 25 milliliters per hour for the past 4 hours. Weight today is 68 kilograms. Admission weight 3 days ago was 72 kilograms. The nurse recognizes that which finding is the most accurate indicator of the client's fluid status? Option A, heart rate of 112 bpm. Option B, blood pressure of 98/58 millimeter of mercury. Option C, weight loss of 4 kilograms over 3 days. Option D, urine output of 25 milliliters per hour. The correct answer is C. Daily weights are the most accurate indicator of fluid status. A 4 kilograms weight loss over 3 days represents approximately 4 liters of fluid loss. 1 kilogram equals 1 L of fluid. This objective measurement provides reliable data about fluid balance, whereas vital signs and urine output can be affected by multiple factors. Question 15. A 55-year-old client has chronic kidney disease, stage 4, type 2 diabetes, and hypertension. The nurse is reviewing the dietary prescription with the client. The client's breakfast tray includes scrambled eggs, whole wheat toast with margarine, orange juice, bananas, and coffee with cream. Which food item should the nurse identify as requiring immediate dietary modification? Option A, orange juice. Option B, bananas. Option C, whole wheat toast. Option D, scrambled eggs. The correct answer is B. Bananas are high in potassium, which is restricted in chronic kidney disease, stage 4, due to impaired potassium excretion. Hyperkalemia can cause life-threatening cardiac dysrhythmias. While other items may also need modification, potassium restriction is the most critical immediate concern for safety. Question 16. A client receiving continuous enteral feeding through a PEG tube develops diarrhea. Which intervention should the nurse implement first? Option A, administer an antidiarrheal medication as prescribed. Option B, check the feeding rate and formula concentration. Option C, reduce the feeding rate by 50%. Option D, stop the feeding and notify the healthcare provider. The correct answer is B. The first step in managing enteral feeding-related diarrhea is to assess potential causes, including too rapid administration or overly concentrated formula. Medications administered through the tube and bacterial contamination should also be assessed. Interventions should address the underlying cause rather than just treating symptoms. Question 17. An adult client weighing 70 kilograms requires nutritional support. Using the standard calculation for calorie needs, what is the estimated daily caloric requirement for this client? Option A, 1,400 calories. Option B, 1,750 calories. Option C, 2,100 calories. Option D, 2,800 calories. The correct answer is B. The standard calculation for adult caloric needs is 25 kilocalories per kilogram per day. For a 70 kilograms client, 70 kilograms times 25 kilocalories per kilogram equals 1,750 calories per day. This provides adequate energy for basic metabolic needs and minimal activity. Question 18. A client with SADH, syndrome of inappropriate antidiuretic hormone, has a fluid restriction of 1,000 milliliters per day. The nurse is planning fluid distribution for this client. Which approach demonstrates correct understanding of fluid restriction management? Option A, Distribute fluids evenly across 3 meals, 333 milliliters with each meal. Option B. Offer 50% of daily fluids during daytime hours and 50% at night. Option C. Schedule 40% of fluids for daytime, with the remainder distributed throughout the day. Option D. Provide most fluids with meals and none between meals. The correct answer is C. Fluid restriction is best managed by distributing fluids throughout the day to prevent excessive thirst and maintain comfort. Approximately 40% of allowed fluids should be available during daytime hours when the client is most active, with the remainder distributed across meals and between medications. Question 19. A nurse is caring for a client who is receiving continuous enteral feeding through a PEG tube. The client is scheduled for a diagnostic procedure that requires lying flat. The healthcare provider's order reads, hold tube feeding 2 hours before procedure. Which action by the nurse demonstrates safe practice? Option A. Stop the feeding 2 hours before the procedure and keep the client in a semi-Fowler's position. Option B. Stop the feeding 2 hours before the procedure and place the client supine 30 minutes before the procedure. Option C. Continue the feeding until immediately before the procedure, then stop and position flat. Option D. Stop the feeding 4 hours before the procedure and keep the head of bed elevated at least 30 degrees until the procedure. The correct answer is D. Safe practice for enteral feeding before a procedure requiring a supine position includes stopping the feeding at least 4 hours in advance and maintaining the head of bed at 30 degrees or higher until the procedure. This allows gastric emptying and reduces aspiration risk during the procedure when the client must lie flat. Question 20. A nurse is teaching dietary modifications to a client newly diagnosed with celiac disease. The client's dinner selection includes grilled chicken, steamed rice, mixed vegetables, and a dinner roll. The client asks if this meal is appropriate. Which response by the nurse is most accurate? Option A. Your meal is appropriate as long as the dinner roll is whole wheat. Option B. You should replace the rice with a gluten-free grain like quinoa. Option C. You need to verify that the dinner roll is gluten-free before eating it. Option D. This meal is not appropriate because all grains must be avoided with celiac disease. The correct answer is C. Celiac disease requires strict avoidance of gluten, found in wheat, barley, and rye. Dinner rolls typically contain wheat flour and are not gluten-free unless specifically prepared as such. Rice is naturally gluten-free and appropriate. The client must verify the ingredients of any bread product before consuming it. Question 21. Which complication of immobility results from the loss of calcium from bones due to lack of weight-bearing activity? Option A. Orthostatic hypotension. Option B. Hypercalciuria with renal stone formation. Option C. Atelectasis. Option D. Pressure injury. The correct answer is B. Immobility causes calcium to be released from bones, demineralization, due to lack of weight-bearing stress, leading to hypercalciuria, elevated calcium in urine, and potential renal stone formation. This is a metabolic complication of immobility. Question 22. The nurse is explaining range of motion (ROM) exercises to a patient's family. Which statement accurately describes the difference between active and passive ROM exercises? Option A. Active ROM requires the nurse to move the patient's joints, while passive ROM is performed by the patient independently. Option B. Active ROM is performed by the patient without assistance, while passive ROM requires an external force to move the joints. Option C. Passive ROM maintains muscle strength, while active ROM only maintains joint flexibility. Option D. Active ROM is used for unconscious patients, while passive ROM is for alert patients. The correct answer is B. Active ROM is performed independently by the patient who can move their own joints through full range, maintaining both joint mobility and muscle strength. Passive ROM requires the nurse or caregiver to move the patient's joints when the patient cannot do so independently. Question 23. A nurse is applying anti-embolism stockings to a postoperative patient. Which finding during the assessment requires immediate intervention? Option A. The stockings are smooth without wrinkles. Option B. The patient's toes are warm and pink with brisk capillary refill. Option C. The patient reports numbness and tingling in the toes on the affected leg. Option D. The stockings are measured to fit properly from heel to thigh. The correct answer is C. Numbness and tingling indicate neurovascular compromise, a sign that the stockings may be too tight or obstructing circulation. This requires immediate removal and reassessment to prevent tissue damage. Question 24. A nurse is caring for a patient who has been immobile for 1 week. Which respiratory intervention should the nurse prioritize to prevent atelectasis? Option A. Administering oxygen at 2 liters per minute by a nasal cannula. Option B. Encouraging incentive spirometry with 10 breaths every hour while awake. Option C. Performing chest percussion every 4 hours. Option D. Positioning the patient in a high Fowler's position continuously. The correct answer is B. Incentive spirometry promotes deep breathing and alveolar expansion, directly preventing atelectasis, collapse of lung tissue, in immobile patients. The recommended frequency is 10 breaths every hour while awake to maintain lung expansion. Question 25. A 68-year-old patient has been on bed rest for 5 days following hip surgery. When the nurse assists the patient to dangle at the bedside before ambulation, the patient becomes dizzy and reports feeling faint. Which action should the nurse take first? Option A. Immediately assist the patient back to a supine position. Option B. Encourage the patient to take slow, deep breaths. Option C. Lower the patient's legs and elevate the head of the bed slightly. Option D. Check the patient's blood pressure and pulse. The correct answer is A. The patient is experiencing orthostatic hypotension, a common complication of immobility. The immediate priority is to return the patient to a safe position, supine, to restore cerebral perfusion and prevent falls or syncope. Question 26. A nurse is preparing to use a mechanical lift, Hoyer lift, to transfer a patient from bed to chair. Which action is essential before initiating the transfer? Option A. Explaining the procedure to the patient's family members. Option B. Verifying that the patient can bear partial weight on both legs. Option C. Ensuring the lift sling is appropriately sized and all equipment is functioning. Option D. Administering pain medication 30 minutes before the transfer. The correct answer is C. Patient safety is the priority. Before using a mechanical lift, the nurse must verify the sling fits the patient properly, all straps are intact, and the lift equipment is in good working order to prevent patient injury during transfer. Question 27. A 72-year-old female patient is admitted with pneumonia and has been on bed rest for 3 days. During morning assessment, the nurse notes that the patient has not had a bowel movement in 4 days and reports abdominal discomfort. Which combination of interventions should the nurse implement to address the patient's constipation related to immobility? Option A. Administer a fleet enema, restrict oral fluids to 1,500 milliliters per day, and maintain bed rest. Option B. Increase fluid intake to 2,500 milliliters per day, encourage high-fiber foods, and assist the patient to a commode chair for toileting. Option C. Start a clear liquid diet, administer a stool softener twice daily, and continue strict bed rest. Option D. Insert a rectal tube, limit physical activity, and administer laxatives as prescribed. The correct answer is B. Immobility contributes to constipation through decreased peristalsis. Effective interventions include increasing fluid and fiber intake to soften stool and promote motility, and using a commode chair, when stable, which promotes better bowel positioning and gravitational assistance compared to bedpans. Question 28. A nurse is caring for a patient who had a stroke with right-sided hemiplegia. The patient needs to be transferred from bed to wheelchair using a stand-pivot transfer technique. The nurse positions the wheelchair at a 45-degree angle to the bed on the patient's left side. Which additional actions should the nurse take? Select the correct sequence of actions. Option A. Place gait belt around patient's waist, lock wheelchair brakes, stand patient up using strong left leg, pivot on left foot toward wheelchair, lower patient into seat. Option B. Lock wheelchair brakes, stand patient up pulling on affected right arm, pivot on both feet, guide patient into wheelchair, remove gait belt. Option C. Place gait belt around patient's waist, position feet together, grasp patient under arms, pivot toward wheelchair, lower into seat. Option D. Lock wheelchair brakes, position patient at edge of bed, stand using strong left leg with gait belt support, pivot toward wheelchair on left foot, lower into seat. The correct answer is D. The correct stand-pivot transfer sequence for a patient with hemiplegia includes securing equipment, locking brakes, positioning at bed edge, using the strong, unaffected leg for standing, pivoting on the strong foot toward the destination, and sitting. A gait belt provides safety without pulling on the affected arm. Question 29. A 58-year-old male patient is recovering from abdominal surgery and has been on bed rest for 2 days. The nurse notes the following assessment findings: blood pressure 100/60 mmHg supine, pulse 92 beats/min, respiratory rate 16 breaths/min, oxygen saturation 94% on room air. The patient has diminished breath sounds in the left lower lobe and reports feeling too weak to get up. Which nursing interventions are most appropriate to address this patient's risk of complications? Analyze the findings and select the best response. Option A. Maintain complete bed rest, apply sequential compression devices, SCDs, and administer oxygen at 4 liters per minute by a nasal cannula. Option B. Encourage incentive spirometry every hour while awake, assist with progressive mobilization, dangling then ambulating, and apply antiembolism stockings. Option C. Request a chest X-ray to rule out pneumonia, administer bronchodilators, and continue strict bed rest until the patient feels stronger. Option D. Increase intravenous fluid rate, apply antiembolism stockings, and restrict mobility until blood pressure stabilizes. The correct answer is B. The patient shows early signs of respiratory complications, diminished breath sounds, borderline oxygen saturation, and cardiovascular deconditioning, weakness, relative hypotension. The priority interventions address respiratory status, incentive spirometry for lung expansion, prevention of further complications, antiembolism stockings for DVT prophylaxis, and progressive mobility to address cardiovascular deconditioning and respiratory status. Question 30. A nurse is caring for 4 patients on a medical surgical unit. All patients have been on bed rest for at least 48 hours. Which patient should the nurse identify as being at highest risk for developing a deep vein thrombosis, DVT, and prioritize for preventive interventions? Option A, patient A, 45-year-old post-appendectomy, receiving 4 fluids, ambulated to bathroom yesterday. Option B, patient B, 72-year-old with heart failure, bilateral lower extremity edema, receiving diuretics, on strict bed rest. Option C, patient C, 38-year-old post-cholecystectomy, on oral pain medication, sat in chair for meals. Option D, patient D, 55-year-old with diabetes mellitus, receiving insulin therapy, performed active ROM exercises. The correct answer is B. This patient has multiple risk factors for DVT: advanced age, 72, strict bed rest, no mobility, heart failure, venous stasis, and bilateral lower extremity edema, indicating venous congestion. Firko's triad, venous stasis, vessel wall injury, hypercoagulability, places this patient at highest risk. The other patients have either mobilized or have fewer risk factors. Question 31. The nurse is assessing a patient's urinary output. Which finding indicates oliguria? Option A, urinary output of 50 milliliters in 1 hour. Option B, urinary output of 300 milliliters in 24 hours. Option C, urinary output of 2,500 milliliters in 24 hours. Option D, urinary output of 100 milliliters in 2 hours. The correct answer is B. Oliguria is defined as urine output less than 400 milliliters per 24 hours or less than 0.5 milliliters per kilogram per hour. Output of 300 milliliters in 24 hours meets the criteria for oliguria, indicating decreased kidney perfusion or function that requires further assessment and intervention. Question 32. The nurse is preparing to insert an indwelling urinary catheter. Which action is essential to prevent catheter-associated urinary tract infection, CAUTI? Option A, secure the catheter to the patient's thigh. Option B, place the drainage bag on the bed rail for easy access. Option C, perform routine daily catheter irrigation with sterile saline. Option D, cleanse the meatus with povidone iodine before insertion. The correct answer is A. Securing the catheter to the patient's thigh or leg prevents urethral trauma and reduces the risk of CAUTI by minimizing catheter movement and potential introduction of bacteria. This is a key component of CAUTI prevention bundles. Question 33. A 68-year-old female patient reports leaking urine when she coughs, sneezes, or laughs. She has had 3 vaginal deliveries. The nurse recognizes this as which type of urinary incontinence? Option A, urge incontinence. Option B, stress incontinence. Option C, overflow incontinence. Option D, functional incontinence. The correct answer is B. Stress incontinence is characterized by involuntary urine leakage during activities that increase intra-abdominal pressure, such as coughing, sneezing, laughing, or lifting. It is common in women with a history of multiple vaginal deliveries due to weakened pelvic floor muscles. Question 34. A 55-year-old male patient has had no bowel movement for 5 days. He reports abdominal discomfort and straining when attempting to defecate. The nurse reviews his medication list and identifies which medication as most likely contributing to his constipation. Option A, metformin. Option B, omeprazole. Option C, oxycodone. Option D, lisinopril. The correct answer is C. Opioid medications like oxycodone are a leading cause of medication-induced constipation. Opioids bind to receptors in the gastrointestinal tract, decreasing peristalsis and increasing sphincter tone, leading to constipation. Patients on chronic opioid therapy should receive prophylactic bowel regimens. Question 35. The nurse is caring for a patient with an indwelling urinary catheter who developed a fever and cloudy, foul-smelling urine. Which action should the nurse take first? Option A. Obtain a urine specimen from the drainage bag for culture. Option B. Remove the catheter if possible per provider order. Option C. Increase the patient's fluid intake to 3,000 milliliters per day. Option D. Irrigate the catheter with sterile normal saline. The correct answer is B. When a patient with an indwelling catheter develops signs of CODI, the first priority is to remove the catheter as soon as possible if it is no longer medically necessary. Catheter removal eliminates the source of infection and is the most effective intervention to resolve CODI. Question 36. A patient with a new ileostomy asks the nurse what to expect regarding stool characteristics. Which response by the nurse is accurate? Option A. Your stool will be formed and similar to your previous bowel movements. Option B. Your stool will be liquid to mushy, and you will need to wear a pouch at all times. Option C. Your stool will be formed, and you may be able to irrigate it like a colostomy. Option D. Your stool will be pasty, and you can use a closed-end pouch most of the time. The correct answer is B. An ileostomy is created from the ileum, small intestine, which is before the colon where water absorption occurs. Therefore, the effluent is always liquid to mushy and high in digestive enzymes. Patients must wear a pouch at all times because the output is continuous and enzyme-rich secretions can rapidly damage skin. Question 37. A 72-year-old patient returns from surgery with a new ascending colostomy. The nurse is teaching the patient about ostomy care and expected stool characteristics. Which statement indicates the patient understands the teaching? Option A. I should expect my stool to be formed and relatively solid. Option B. I can control when I have a bowel movement by doing irrigation. Option C. My stool will be liquid and I need to empty the pouch frequently. Option D. I can use a stoma cap instead of a full pouch most of the time. The correct answer is C. An ascending colostomy is created in the ascending colon, early in the large intestine where minimal water absorption has occurred. The stool will be liquid, similar to an ileostomy, and the patient will need to empty the pouch frequently throughout the day. Question 38. The nurse is assessing a patient's new ostomy stoma on postoperative day 3. The stoma appears pale pink and slightly edematous. The patient reports mild discomfort but no severe pain. Which action should the nurse take? Option A. Document as normal finding, no intervention needed. Option B. Apply a warm compress to improve blood flow. Option C. Notify the surgeon immediately for possible ischemia. Option D. Gently massage the stoma to stimulate circulation. The correct answer is C. A healthy stoma should be pink-red, moist, and glistening. A pale pink stoma on postoperative day 3 suggests compromised blood flow and possible ischemia, which is a surgical emergency. The nurse must immediately notify the surgeon as this could progress to necrosis, requiring surgical revision. Question 39. A 45-year-old male patient reports sudden, strong urges to urinate followed by involuntary leakage. He sometimes cannot reach the bathroom in time. He denies leakage with coughing or sneezing. The nurse develops a plan of care. Which intervention is most appropriate for this type of incontinence? Option A. Teach Kegel exercises to strengthen pelvic floor muscles. Option B. Implement timed voiding every 2 to 3 hours. Option C. Encourage restriction of fluids after 6 p.m. Option D. Instruct to perform intermittent self-catheterization. The correct answer is B. This patient is experiencing urge incontinence, overactive bladder, characterized by sudden, intense urges to void followed by involuntary leakage. Bladder training with timed voiding is a first-line behavioral intervention. The patient voids on a schedule, every 2 to 3 hours initially, to prevent bladder overdistension and gradually extends intervals to increase bladder capacity. Question 40. A patient with a history of benign prostatic hyperplasia, BPH, is admitted with abdominal distension and reports being unable to void for 12 hours. The nurse palpates a firm, round mass above the symphysis pubis and obtains a post-void residual of 450 milliliters via bladder scanner. Which type of incontinence is this patient experiencing, and what is the priority intervention? Option A. Stress incontinence. Schedule pelvic floor rehabilitation. Option B. Overflow incontinence. Insert indwelling urinary catheter. Option C. Urge incontinence. Initiate anticholinergic medication. Option D. Functional incontinence. Provide bedside commode. The correct answer is B. This patient has overflow incontinence caused by urinary retention from BPH obstruction. The inability to void, palpable bladder, and high post-void residual, 450 milliliters, indicate retention with overflow. The priority intervention is catheterization to relieve retention and prevent bladder damage or infection. The cause, BPH, must then be addressed. Question 41. A client with a left leg fracture is being taught crutch walking. The nurse observes the client placing the crutches 6 inches in front of the feet and 6 inches to the side of each foot. What should the nurse do? Option A. Correct the client. Crutches should be placed 3 inches in front. Option B. Document that the client demonstrates proper crutch placement. Option C. Inform the client the crutches are too far to the side. Option D. Instruct the client to place crutches 12 inches in front for better stability. The correct answer is B. Proper crutch placement is 6 inches anterior and 6 inches lateral to the feet, providing a stable tripod position. This placement ensures optimal balance and weight distribution. Question 42. A client with a right leg cast is learning to ascend stairs using crutches. Which statement by the client indicates correct understanding of the technique? Option A. I'll put my right leg up first, then my left leg and crutches together. Option B. I'll put my crutches up first, then my left leg, then my right leg. Option C. I'll put my left leg up first, then my right leg and crutches together. Option D. I'll put both crutches and my left leg up together, then my right leg. The correct answer is C. When ascending stairs with crutches, the mnemonic is up with the good. The unaffected leg, left leg, goes up first to the next step, then the affected leg and crutches follow together. This allows the strong leg to bear weight and lift the body. Question 43. A nurse is teaching a client about the 4-point crutch gait. Which statement by the client indicates a need for further teaching? Option A. This gait provides maximum stability because 3 points are always on the ground. Option B. I need to move my right crutch first, then my left foot, then my left crutch, then my right foot. Option C. This gait is appropriate when I can bear weight on both legs. Option D. This is the fastest crutch gait, and I should use it when I'm in a hurry. The correct answer is D. The 4-point gait is the slowest crutch gait, not the fastest. It provides maximum stability with 3 points of contact at all times, but sacrifices speed for safety. The swing-through gait is the fastest. Question 44. A client with a non-weight-bearing right leg fracture asks why they cannot use the 2-point gait. What is the nurse's best response? Option A. The 2-point gait is only for clients who have had crutches before. Option B. The 2-point gait requires some weight bearing on both legs, which your injury doesn't allow. Option C. The 2-point gait is too complicated for new crutch users. Option D. The 2-point gait is only used for descending stairs, not for walking on level ground. The correct answer is B. The 2-point gait, like the 4-point gait, requires partial weight bearing on both legs. With a non-weight bearing restriction on the right leg, the client should use the 3-point gait where all weight is borne by the unaffected leg and both crutches. Question 45. When teaching a client about proper cane use, the nurse should instruct the client to hold the cane on which side? Option A. The affected side to provide direct support. Option B. The unaffected side to widen the base of support. Option C. Either side, whichever feels more comfortable. Option D. The affected side only when going upstairs. The correct answer is B. The cane should be held on the unaffected, strong side. This widens the base of support and allows the cane to move forward with the affected leg, providing stability when weight is shifted to the weaker side. Question 46. A nurse observes a client using a walker. Which action by the client requires immediate intervention? Option A. The client lifts the walker, places all 4 legs down, then steps into it. Option B. The client keeps the walker 6 to 8 inches ahead while walking. Option C. The client pushes the walker forward while stepping forward simultaneously. Option D. The client wears non-skid shoes while using the walker. The correct answer is C. This is unsafe because the client is not maintaining stability. The proper technique is to lift or roll the walker forward, ensure all 4 legs are stable on the ground, then step into it. Moving the walker and stepping simultaneously can cause loss of balance and falls. Question 47. A nurse is preparing to transfer a client from bed to wheelchair using a stand pivot transfer. Which action should the nurse take first? Option A. Apply a gait belt around the client's waist. Option B. Lock the wheelchair brakes. Option C. Raise the bed to the nurse's waist level. Option D. Instruct the client to cross their arms over their chest. The correct answer is B. Safety is the priority. The wheelchair must be locked before any other transfer preparation to prevent the chair from moving during transfer, which could cause a fall. After locking brakes, the nurse would apply the gait belt, position the chair, and then assist with the transfer. Question 48. A client with bilateral lower extremity weakness and non-weight-bearing status needs to be transferred from bed to wheelchair. Which transfer method should the nurse plan to use? Option A. Stand pivot transfer with gait belt. Option B. Stand assist transfer with 2 nurses. Option C. Mechanical lift, Hoyer lift. Option D. Sliding board transfer. The correct answer is C. A client who is non-weight bearing on both legs cannot participate in a stand pivot or stand assist transfer. A mechanical lift is required for clients who cannot bear weight. A sliding board is for lateral transfers when the client has some upper body strength and can assist. Question 49. Before assisting a client to sit in a wheelchair, the nurse should ensure which of the following? Select all that apply. Option A, wheelchair brakes are locked. Option B, footplates are swung away or removed. Option C, client is wearing shoes or non-skid socks. Option D, armrests are removed on both sides. E, bed is positioned lower than the wheelchair seat. The correct answer is A. Wheelchair brakes must be locked to prevent movement. Footplates must be swung away to allow safe transfer and prevent tripping. Clients should wear shoes or non-skid socks for safety and foot protection. Armrests are typically left in place unless specifically needed for transfer. The bed should be at the same height or slightly higher than the wheelchair seat, not lower. Question 50. A nurse is lifting a box of medical supplies from the floor. Which action demonstrates proper body mechanics? Option A, bending at the waist with straight knees. Option B, keeping the box away from the body to maintain balance. Option C, twisting the torso while lifting to face the direction of movement. Option D, bending at the knees with a wide base of support. The correct answer is D. Proper body mechanics include wide base of support for stability, bending at the knees, not waist, to use leg muscles, keeping the load close to the body's center of gravity, and avoiding twisting. This prevents back injury and maintains balance.